Well, good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, February the 10th, 2021. Joining us today is Mayor John Tory, the Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg, and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory?
Well, Brad, thank you and good afternoon. Today we're providing an update on the City of Toronto's preparations underway now for COVID-19 vaccinations. While we continue to manage the overall pandemic and the emerging concerns we have in regard to the new variants, we are not losing sight of the future and the hope that the vaccines bring for us. We are close to putting COVID-19 behind us, I truly believe that, but a big factor in that will be the vaccine and the vaccination process. Before I provide further information on the work that we continue to do as a city in our preparation plans, I want to repeat who does what when it comes to the COVID-19 vaccines. The Government of Canada is responsible for obtaining the supply of COVID-19 vaccines. The Government of Ontario has responsibility for distributing those vaccines and for deciding who gets vaccinated, when, and where. The province will also be running the vaccination registration system when the time comes, which, without oversimplifying it, will be when we have a large amount of vaccine supply for mass immunizations. The City of Toronto, along with Toronto Public Health, is responsible for supporting the province's vaccine rollout. We want to be ready as soon as we can get the green light, and I can tell you that based on the Immunization Task Force update we received last night, and you'll hear more about that from Chief Pegg, we will be ready. When we launched the Metro Toronto Convention Centre vaccination site, we made it clear that it was a proof of concept for what would be one of many vaccine clinics across Toronto and would help in setting up such clinics in other parts of Ontario as well. Like the annual flu shot campaign, we expect our large vaccination clinics will be just one part of the overall vaccination effort. Depending on the type of vaccine available, we anticipate the majority of people will ultimately get their shot at a pharmacy or from their doctor. But there is still an important role for our large vaccination sites to play. These locations have been strategically picked across the city based on a number of criteria, including location and the size of the building. You're aware of the Metro Toronto Convention Centre I mentioned earlier. That is one of the sites. And while the other 8 clinics are not yet operational, they will be located at the Toronto Congress Centre in the northwest corner of the city, Malvern Community Recreation Centre, the Hangar in North York in the Downsview Park area, Scarborough Town Centre, the Cloverdale Mall, Mitchell Field Community Centre, the North Toronto Memorial Community Centre, and the Carmen Stefano Community Centre. Chief Pegg will outline the operational details, but it is good to know that the Malvern Community Centre Clinic, for example, is fully assembled and is ready to go as soon as vaccine supply becomes available and the provincial mandates are received. The other sites are on schedule to be prepared and ready for operations in the coming weeks. These sites will also support stand-up clinics, mobile clinics, response teams, and so they represent only part of an overall vaccination delivery system, which also includes, as noted earlier, family doctors and pharmacies and some of our healthcare partners, including hospitals. We are making these large sites, the location of these large sites, public today so that our healthcare partners can continue to plan their own vaccination sites. This will avoid duplication and allow for better planning for all of us. We're working alongside our healthcare partners to ensure that all areas are being serviced and all communities will be served. The creation of these clinics is only one part of our plan for the vaccination rollout. In partnership with the province and, very importantly, community agencies, we are planning targeted vaccination campaigns for high-risk and vulnerable populations. This will include, for example, mobile clinics to serve our homeless population and clients of our shelter system, and targeted mobile clinics in high-transmission neighbourhoods, just to name 2 examples. We know there are a lot of mixed feelings about vaccination, and we want to do everything possible to make residents, all residents, feel confident about getting vaccinated and about the experience itself. Our outreach, as a result, will focus on groups that have been hardest hit by the pandemic, including the Black community, Indigenous community, South Asian community, isolated seniors, and refugees. This effort will also take into account communities which have a higher rate of vaccination hesitancy. A few examples of that work, which is underway, include the Black Community COVID-19 Response Plan, which was outlined last week. Through this plan, and in partnership with our Black Scientist Task Force on Vaccine Equity, we aim to address the vaccine hesitancy among Toronto's Black community and ensure that they have all of the up-to-date information they need when it comes time to assessing their accessing and receiving a vaccination. We've also reached out to South Asian communities and are currently working with community leaders to determine the engagement that will work best for them. And finally, the City is also actively engaging with the Indigenous community through our Indigenous Affairs Office. All of this work is focused on making the vaccines accessible while at the same time building trust and combating vaccine hesitancy. In the coming weeks, we will have more details to share on this specific work. I want to repeat a few things so that we are very clear. We have 9 sites across the city that will be ready to administer up to 120,000 vaccinations a week, depending on provincial priority setting and timetabling. These sites are not opening tomorrow, so please do not line up or approach these sites tonight or until further notified. They are dependent on the federal government's vaccine supply, but we are readying these sites and letting you know where they are as part of what is one of the largest, if not the largest for sure, vaccination mobilization efforts in the history of the city. This is a team effort to get everyone vaccinated. We expect the majority of people, in fact, will not be vaccinated at these sites. Instead, they are more likely to receive their vaccination at a pharmacy or from their doctor. But we are working nonstop to make sure that these clinics and the entire network I've described today are ready within the purview of what we are responsible for. I cannot stress this enough. This is a very, very important point as part of this discussion today. Getting vaccinated is the right thing to do. It will help protect you and your family and your friends and your co-workers. And that is why your city government is working to support the other governments in rolling out the vaccine and in making sure people are well informed and that some of their questions or concerns are addressed proactively by us as a lead up to this vaccination effort. All of this detailed planning work is happening while Toronto Public Health and our city's hospitals continue to vaccinate residents and staff in long-term care homes and retirement homes across Toronto, for example. Second doses of long-term care and retirement home residents are being administered now, and that task, that very important task, is expected to be completed by the end of next week. We are making progress. Our experience over the last several weeks with the vaccine supply has given us the time to deal with this, and we have we've ensured that we'll be ready for this larger rollout when the time comes. Now, to offer some further details on our immunization efforts, I will ask Chief Pegg to present his report for today.
Thank you, Mayor Tory, and good afternoon. In November 2020, our COVID-19 Immunization Task Force began the process of identifying and securing facilities to be used as city-operated immunization clinics. As part of our response to the COVID-19 pandemic, we have developed a robust and scalable plan for the provision of an initial network of immunization clinics across Toronto that will support the overall mass COVID-19 immunization effort. Additionally, we have built and implemented comprehensive incident management and support systems by leveraging our Emergency Operations Centre, ensuring that our immunization clinic operations are fully supported. Our overarching immunization strategy includes city-operated clinics, additional clinics that will be operated by both hospital and community partners, mobile clinic operations, prioritized community response, and the eventual widespread availability of vaccine through primary care physicians and local pharmacies. The deployment of city-operated immunization clinics forms the backbone for this important work. The target for the commencement of city-operated immunization clinic operations continues to be in early April. This date has been established in collaboration with General Hillier and the Provincial Vaccine Distribution Task Force in direct response to the forecasted availability of COVID-19 vaccine. However, our plans are nimble and we are ready to accelerate the initiation of immunization clinic operations as required. On January 18th and 19th, at the request of the province, we opened and operated a proof-of-concept immunization clinic at the Metro Toronto Convention Centre. This clinic is one of 9 city-operated immunization clinics that are planned. While operations at this clinic are currently on hold, pending vaccine availability from the provincial government, we will be reopening this clinic on February 15 and 16 in order to administer the second doses of COVID-19 vaccine to each of the 378 healthcare workers who received their first vaccine dose in this clinic in January. The reopening of this clinic on February 15 and 16 will only be for the purposes of administering these scheduled second doses of vaccine. New first doses of vaccine will not be administered during the upcoming 2 days of operation, nor will this clinic be open to the public. Each of the 378 healthcare workers who received their first dose during the proof-of-concept immunization clinic have been scheduled to attend on either February 15 or February 16. The planning and preparations for the remaining 8 city-operated immunization clinic locations that Mayor Tory announced are well underway. In fact, the Malvern Community Centre Clinic has already been fully assembled and is ready to go as soon as vaccine is available. Further, the clinic inside the Toronto Congress Centre is being assembled now. We are continuing to prep the 7 remaining clinic locations, city-operated clinic locations being prepped and ready to go on or before April 1. The decision as to when any or all of these city-operated immunization clinics will open and operate lies with the province, in accordance with vaccine availability. Likewise, the determination as to who will be prioritized for vaccination within the city-operated immunization clinics also lies with the province, in accordance with the provincial prioritized vaccine distribution framework. Our commitment has been to ensure that the City of Toronto is ready to go when the time comes, and we will be. Our teams have been at work non-stop since November, and that work continues 7 days per week. Our comprehensive COVID-19 immunization plan includes 4 key tactical elements, each of which operate under the medical direction of Toronto Public Health. Our plan includes providing advice, education, and support to partner hospitals and community agencies, operating a network of large city-operated immunization clinics, operating a network of smaller city-operated community-based immunization clinics, and operating and deploying both city-operated community response vaccination teams and mobile clinics on an on-demand basis. As Mayor Tory also explained, our Immunization Task Force Community Liaison Team is engaged in developing and implementing a targeted approach to ensure universal equity for vaccine access. The team is working with racialized communities to determine the best approach to meet each community's unique needs and interests. Last week, we announced the Black Community COVID-19 Response Plan, developed to provide enhanced support for Black Torontonians. Our team has also reached out to South Asian communities and is currently working with community leaders to determine the engagement that will work best for them. We are also actively engaging with our Indigenous communities through our Indigenous Affairs Office. This important work will ensure that every Toronto resident has effective and efficient access to COVID-19 vaccine as soon as they are available. Within the present planning framework, more than 120,000 COVID-19 vaccines will be able to be administered each week through the network of 9 city-operated immunization clinics once they are operating as planned. In keeping with my commitment to you from the outset, our plans are both scalable and nimble, such that we will be able to respond to changes in the vaccine availability landscape. Once operational, our city-operated immunization clinics are planned to operate 7 days per week, with vaccines being administered over a 9-hour period each day. Staff will be on site in each clinic, both before and after the 9 operational hours, in order to ensure that all aspects of infection prevention and control and the many required administrative and reporting tasks are completed daily. At the point when we are fully operational, a team of more than 1,400 staff will be engaged, enabling us to maintain operations 7 days per week. Our 9 city-operated clinics will leverage the provincial COVAX software system, ensuring that our clinics are connected directly with our provincial partners in live time. Once vaccine is available, and once the next phase of vaccine prioritization and rollout has been determined by the province, there will be a clear and widespread communication. When the time comes, we will ensure that we communicate clearly as to where and when you can receive your vaccine and what the process of making your appointment will be. However, to be very clear, none of the 9 city-operated COVID-19 immunization clinics that we are announcing today are open at present, nor do we have confirmation as to when the clinics will be able to open as of yet. This is dependent on the availability of vaccine as advised by our provincial partners. Once we have additional information relating to the timing of the commencement of clinic operations, we will update you directly and will ensure that toronto.ca/COVID-19 always contains the most current information. In closing, it is important to reiterate that our overarching immunization strategy includes not only the 9 city-operated clinics, but also a number of clinics that will be operated by hospital and other community partners, mobile clinic operations, targeted community response, and the eventual widespread availability of vaccine through family doctors and local pharmacies. Our city-operated immunization clinics are just one piece of the immunization plan. There will be many opportunities for vaccination for all Toronto residents once the supply of vaccine is reestablished. Thank you. I'll now invite Dr. de Villa to bring her remarks.
Thank you, Chief Pegg, and good afternoon. Today I'm reporting 440 new cases of COVID-19. 426 people are in hospital, and sadly, 16 people have died. There are 32 confirmed cases of the UK variant in Toronto. Living with COVID-19 right now is like trying to find our way out of a maze. As we look around, almost everything looks the same, no matter where we turn. There are choices about which way to go. What looks like the way out can come to a dead end. Even so, step by step, we are finding our way toward the exit. The vaccines are part of the pathway out of this maze. There are many people who'd roll up their sleeve for one of the vaccines the minute they get the chance. And there are some who are hesitant. Often, you hear the concern about the speed with which the vaccines were developed. I would say this: medical researchers and scientists were able to develop these vaccines this quickly, not for lack of caution, but on the strength of modern science and the speed of modern technology. If a threat of this nature was to confront us in our lifetimes, better it happened now, with so much knowledge and science available to us, more than at any other time in human history. I'm not certain that even just 5 years ago, we could have developed vaccines such as we have today in the same amount of time. Canada has approved 2 vaccines, from Pfizer-BioNTech and Moderna, and 2 wait approval, which I hope will be soon, that from Oxford AstraZeneca and Johnson & Johnson. There have been delays in delivery, which is frustrating for everyone. So for now, most of us are waiting our turn. From a public health perspective, I must ask that you wait mindfully. There are a significant number of risks to us because of the variants we've talked about increasingly in the last several days. I believe that will continue in the weeks ahead. The variants and the vaccines intersect on our way out of the pandemic because one can affect the other. Variants can grow into a significant public health threat, spreading widely and with potentially overwhelming speed, thanks to mutations that make the virus easier to catch. The UK has been in full lockdown since January the 4th and is still developing its exit plan. We know there are 32 confirmed cases of variants of concern in Toronto. The variant spread from elsewhere gives us every reason to believe variants will spread here in the same way. So in the weeks ahead, let's make decisions about the degree to which we mix with one another to make it harder, not easier, for COVID-19 to spread in any form. We do not want to make the situation worse. That's dangerous to health, to life, to the economy, and potentially to the vaccines we're all counting on. The more the virus spreads, the more it can mutate, creating the risk that more or new variants of concern will confront us and create more delay on the road back to normal life. We do not want the variants to complicate the role of vaccines in bringing an end to the pandemic. So as ever, it is my job to urge you to keep strictly apart as much as absolutely possible in anticipation of our access to the vaccines we are all counting on. The vaccines work. We must be ready for them. In the current environment, readiness is more than waiting. It's keeping our distance, staying home, wearing well-fitting masks, and limiting interaction to keep the virus at bay until we receive the vaccines that will cut off its ability to thrive. I'll now turn it over to Brad.
Thank you very much, Dr. de Villa. Before we go to questions, just a reminder to our friends on the line that you must unmute yourself before you're asking your question, and we'll go first to Trevor Dunn from CBC News. Trevor, go ahead, please.
Thank you, Brad. Good afternoon, everyone. This is for Mayor Tory. Mayor Tory, I'm wondering if you could speak a little bit more about the federal announcement today about public transit funding. Toronto is going to get a share of that. You said earlier it'll have a big impact on the city. I'm wondering if you could speak a little more specifically about what residents and TTC riders can expect. Are we going to spend this on new vehicles, expanded projects? What can you say about it?
I can say first and foremost, this is a very historic and much welcomed announcement by the City of Toronto and by cities across Canada, because what it now provides is permanent, predictable funding for at least the next 8 years for transit. As for the, we don't have all the details yet as to the parameters of the program, but I can tell you that the likelihood is that we would use it in the City of Toronto to fund expansion through programs or projects such as the Eglinton East, Scarborough East LRT or waterfront transit, and we would most certainly be able to use it as well based on what we know so far about for the purchase of new streetcars, buses and subways, all of which people know that we need. So this is a big step forward. This is from a government that I think seems to get cities in the context of the great need to continue to build and properly look after transit systems, and it's very welcome, and it's going to help us to take even more steps forward.
Certainly it looks that way. In the meantime, the TTC is facing pretty severe budget shortfalls due to ridership decline during the pandemic. Doesn't look like this funding will help with that, but correct me if I'm wrong, and if not, what's the plan there?
Well, we've been having continuous discussions. I've talked in the last 7 days or even shorter period of time with the Minister of Intergovernmental Affairs, the Deputy Prime Minister, the Finance Minister, and this morning the big city mayors met with the Prime Minister. And I can just tell you that they're very mindful of the challenges we face on the operating side of transit systems, and I'm sure we'll have more to say about that in the coming days. But those discussions have been underway. I continue to pursue that relentlessly, and I think I'm meeting with, quite a receptive audience when I make those representations alongside my big city mayor colleagues from across the country.
right, thank you. We'll go next to Mark McAllister from City News. Mark, go ahead, please.
Thank you very much. Perhaps, Chief Pegg, you can speak to this. While you've emphasized, each of you have emphasized that these clinics are not open and won't be open until the province has supply in hand, what more will be done aside from telling us that today and counting on us to relay that message to help organize and educate people on who will be able to get vaccinated, where, and when?
Well, Mark, what more will be done? So first and foremost, we'll continue to communicate clearly and openly with the best and most timely information that we have. We will continue to ensure that our toronto.ca/COVID-19 website is kept up to date. And while the vaccine supply and availability issues continue to be worked out between the provincial and federal governments, we will be hard at work here, continuing to assemble and build and prepare each of our 9 city-operated clinic locations to ensure that they are set up, they are ready, that our staffing is in place, and that we are ready and able to go as very soon as the province can make vaccine available to us. So we have done much work. We have much work ahead of us. That work will carry on, and all, of course, in support of our overarching goal with respect to clinic operations to be ready to go as very soon as vaccine is available.
Just before, Mark, your supplementary, can I just say something that Chief Pegg would be too modest to say himself? You have to focus on what's been done so far. I asked that a task force be established, I think, even before there was a vaccine, because we knew that whatever our rule would end up being, we had to be ready. And if you look at the work that has been done to identify sites, which was no easy feat in a busy city, to find places that were of the right size and location, to start to reach out and build relationships with community health partners, to go through the exercise, which is still going on, of hiring literally hundreds of people. I think Chief Pegg mentioned 1,200 people would be involved at the end of the day, and to develop a communications plan, which I can assure you is going to be a key element of all this when it unfolds. You have to have it ready to go. This is a huge piece of work done by the city government under the leadership of Chief Pegg, and it's a lot, and we just wanted to share the first details of that with the public so they'd know we were on the job, even though we're saying please don't go to the locations that have been identified because they're not open yet.
Thank you, and perhaps this is supplementary material that will come as the locations start to open, but can you give us a sense of what the capacity will be and how many people can be brought into those 9 locations at any given time?
Sure, I'll do. I don't have the actual specific spreadsheet with me, Mark, but I can tell you that our network of 9 clinic locations are actually broken across or include 3 immunization clinic models. The largest sites, such as the Metro Toronto Convention Centre, are designed to have 40 immunizers at any given point in time, and that's actually expandable within that space. We have clinics that are designed to have 30 concurrent immunizers, and clinics that are designed to have anywhere from about 6 to 15 immunizers, depending on the available space. And that is the determination. They're scaled based on the available space inside the building and the supporting space, things like storage and lockup and access to washrooms and parking and all of those logistics that go into that. So there is a very wide range, ultimately culminating into no less than 120,000 people that will be able to move through that network of 9 sites on a daily basis. And like all of our plans, even those plans are scalable. They could be scaled up and increased depending on the availability of vaccines. So we're proactively working to make sure that we can obviously scale down. We hope not to ever have to do that again, but obviously to be able to scale up as the supply of vaccine increases.
Thank you. We'll go next to Matt Bingley from Global News. Matt?
Hi, good afternoon. Chief Pegg, if I can follow up on Mark's question there, I'm just wondering how, if you could just give a little bit more clarity of how people will be told where to go. And you were talking about the vulnerable populations, how you will be keeping track of people and making sure that they get their second dose. And if I could just squeak one little supplementary into for Dr. de Villa, you talked about mutations. Could you just provide just a little bit more clarity of how concerned you are about it actually mutating here?
So perhaps I'll start and then I'll turn to Dr. de Villa. So with respect to how and where we will communicate, that will include a number of strategies and via a number of forms. So here at these press conference will be one. We will make sure that we communicate as very soon and as very clearly as possible. We of course communicate across a wide network of social media platforms, and of course making sure that our toronto.ca/COVID-19 website is updated continuously with the most accurate information. We are of course directly connected with General Hillier and the Provincial Vaccine Distribution Task Force, and I can tell you I meet with General Hillier almost on a daily basis, and the coordination of communications and dissemination of information is a standing agenda item. And of course, as vaccine availability increases, something that will be a principal focus not only for us in the city, but also for our provincial partners. I will turn to Dr. de Villa for the remainder.
Sure. So, Matt, with respect to mutations, variants of concern, by their own very title, they give rise to concern. We've seen the experience from other jurisdictions as these new variants, the new strains of coronavirus emerge. We've seen in the UK, we've seen in Denmark, we've seen in South Africa, we've seen in Brazil, that these new variants, particularly the ones that spread more readily, that can be caught more readily from one person to the next, they become the dominant strains. And so, to my mind, from the scientific perspective, every single time COVID spreads from one person to the next, there is an opportunity for that mutation to occur. Right? As the virus spreads from one person to another, it needs to replicate, and it's with each replication that there is an opportunity for mutations to arise. Some of those mutations give rise to more transmissibility. They give the virus better capacity to spread from one person to the next. That's just one variation on the kinds of mutations that can occur, which is why, at this point, what I was asking people to do is to really focus on what they can do to limit the spread of COVID-19 or to limit their exposure to COVID-19 by restricting their interactions. The more we restrict our interactions, the more we're able to reduce the spread of COVID-19, and the less likely the opportunity arises for mutations to occur, and the more likely we are making it for vaccines to do the work that they need to do to help us move beyond the pandemic.
Okay, thank you for that, and my apologies for squeezing those both in. It would just be a little harder for this turn. Mayor Tory, I'm just wondering, from the Raptors, we're hearing that the lawsuit has been dropped against Masai Ujiri. I'm just wondering, you had some comments on it when the body cam footage first appeared. I'm just wondering, on the legacy of the sour ending of this and where we go now, what your thoughts are.
I don't think it's a sour ending when the lawsuit is dropped. It's a kind of a sour process that went on because I knew from the beginning, I said months ago, as many people in Toronto would feel. Anybody who's ever met this man would know this is a man with the finest of characters. The video footage really just proved what we all knew to begin with, which is that he wouldn't think of doing anything that was out of hand. He's a role model for many people in this community. He understands that. He lives his life pursuant to that. He's a great team executive and just a proud resident and citizen of this city. So, I'm sure he has some feelings as to what went on, and denying him the opportunity to celebrate one of the most historic moments I'm sure he'll face in his sports career. But it's over, and that's a good thing, and I think it ended the right way from the standpoint of him and his character and what it says about those things that we already knew.
Great. Thank you very much. We'll go next to Francine Copen from the Toronto Star. Francine, go ahead, please. Hey, Francine, you just have to unmute yourself there. If you're on a phone, it's star 66. There you go. Go ahead, Francine.
Oh, hi. Can you hear me?
We can, yes.
Okay, great. Sorry for the delay.
That's okay.
My question is for Chief Pegg. It's been pointed out that the majority of people, it's expected, will get their shots at their doctor or at a pharmacy. And yet these clinics will be operating, these 9 clinics will be also immunizing 120,000 people a week. So who's going to be sent to the clinics and who's going to be sent to doctors and pharmacies? How is that going to be divided up?
Yeah, thanks, Francine. So the decision with respect to the prioritization of vaccine administration, so perhaps in easier terms, the decisions as to who will be vaccinated and when and in what sequence and time frame and priority lies with the province of Ontario. So they will ultimately determine that prioritization. Our commitment was and has been to ensure that we prepare and stand up and operate a network of city-operated clinics which provide additional access to vaccine that can be leveraged and accessed under provincial direction and, of course, under Toronto Public Health direction. We know, and if you've heard, which I know you have, if we've listened to General Hillier and you simply understand the distribution network of pharmacies across the city, there are, I believe, as many as 1,200 pharmacies across the City of Toronto alone. So the opportunity for mass immunization through community partners, including family doctors and pharmacies, is exponentially higher than what any network of mass immunization clinics could achieve. That being said, our commitment is to make sure that we are ready. It is to make sure that we are doing everything we can possibly do to make vaccines available to our residents as very quickly as possible, hence the development of our 9 city-operated clinic network.
And my follow-up question is, will these things be happening at the same time, or will the vaccination clinics be opening first, followed by the capacity to deliver the shots in doctors' offices and at pharmacies?
So that as well remains to be determined and will, again, ultimately be determined by the province of Ontario, with the principal deciding factor being the ultimate availability of vaccine. We are all eagerly awaiting the day where we have virtually unlimited or literally unlimited access to vaccine, and ultimately our collective goal, both from a city perspective and a provincial perspective, is to have all of these mechanism and means of immunization open, running concurrently, with the simple but overarching goal of affording everyone who wants a vaccine access to that vaccine as very soon as possible. But we are dependent on the supply of vaccine from the province, and they, of course, as Mayor Tory pointed out at the start of his remarks, are dependent upon the procurement and supply of that vaccine from the feds. We eagerly await those shipments and the increase in that availability.
I'd just like to make one more comment, which is beyond all the work that Chief Pegg and the task force have done within the city government to get these clinics identified as to the sites and start to staff up and make sure they're properly equipped. We're not waiting to get on with some of this work that we have to do with regard to, say, vaccine hesitancy. And one of the reasons we announced last week we're establishing the Black Scientists Vaccine Task Force was so that that very task force and members of it are starting to conduct town halls to deal with getting out public information and addressing vaccine hesitancy, for example. And a lot of that kind of work and the establishment of those sorts of relationships with community health partners is being done now, so that whenever the day comes that the province gives the green light in terms of supply and other issues, we're ready to go. That's the whole objective of today, is to indicate to people that on many fronts we have been doing a lot of work under Chief Pegg's leadership and that we're going to be ready.
All right, thank you. Final question is to Natalie Johnson from CTV News. Natalie, go ahead, please.
Hi there. I'm just wondering if you can tell me how people will sign up and make appointments for vaccination at these city-run clinics. Is this going to be done through the software portal that the province is setting up, or does the city have a separate system for that?
Hi, Natalie. It will, in fact, be a function of the provincial system that is being set up. So our clinic operations are entirely based upon and, in fact, standing on the foundation of the province of Ontario's COVAX software system, and they have been hard at work and continue to be hard at work, evolving and continuing to expand the functionality of COVAX to include registration and scheduling modules. So at such point in time as we're able to open these clinics, we will rely on the province of Ontario's scheduling system, and all aspects of our clinic will be directly connected through COVAX, which will, of course, give not only Dr. de Villa and the Toronto Public Health team, but also the province of Ontario lifetime access to clinic operations and vaccine administration rates and dosing and everything required from a logistics standpoint.
Thanks. Just as a follow-up, I understand that the system that the province is going to be implementing is the same software, or at least part of the same software that's being used in some American states, including California. It sounds like there have been a number of glitches with the software in use for vaccination booking in the States. I'm wondering if you have any concerns about how that rollout will play out here.
I have no visibility into the software systems that are operating in the States. I can tell you that we have established a robust network of colleagues from across North America that I meet with once a week and discuss this. Those concerns have not been raised with me. That being said, I will say that the COVAX solution is in fact the same solution that we operated and that we evaluated during the proof of concept operation at Metro Toronto Convention Centre. It has been used and is in use across the province, and all of the lessons learned that came out of the proof of concept operation at the Metro Convention Centre in January have not only been compiled in the city, we've had the opportunity to share them directly with General Hillier's team in the province, and I can attest, because I'm on the daily meetings, the province has been working nonstop at evolving that and ensuring that there is a reliable, consistent and robust software platform and the hardware associated with connecting to it, availability to support not only our city-operated immunization clinic efforts, but the immunization clinic efforts and immunization efforts en masse across the entire province of Ontario. So a lot of work going on, but we look forward to benefiting from all of the good work that's being done by our provincial colleagues.
All right, thank you very much for joining us. That concludes today's briefing. Our next briefing is next Wednesday, February 17th, as Monday is Family Day. So please stay well and enjoy your weekend. Take care.